revealed how drugs giants can access your health records. Experts say information sold on by Department of Health and Social Care can be traced back to individual medical records. The Department of Health and Social Care has been selling the medical data of millions of NHS patients to American and other international drugs companies, having misled the public into believing the information would be anonymous, according to leading experts in the field. Senior NHS figures have told The Observer that patient data compiled from GP surgeries and hospitals, and then sold for huge sums for research, can routinely be linked back to individual patients' medical records via their GP surgeries. They say there is clear evidence this is already being done by companies and organizations that have bought data from the DHSC, having identified individuals whose medical histories are of particular interest. Concerns that the data is not truly anonymous have been raised by senior NHS officials, who believe the public are not being told the full truth. But the DHSC insists it only sells on information after thorough measures have been taken to ensure the complete anonymity and confidentiality of patients' personal information. In December, The Observer revealed that the government had raised £10 million in 2018 by granting licenses to commercial and academic organizations across the world that wanted access to so-called anonymized data. If patients do not want their data to be used for research, they have to actively opt out of the system at their GP surgery. Access to NHS data is increasingly sought by researchers and global drugs companies because it is one of the largest and most centralized public organizations of its kind in the world, with unique data resources. Washington has already made clear it wants unrestricted access to Britain's 55 million health records, estimated to have a total value of £10 billion a year, as part of any post-Brexit trade agreement. Leaked details of meetings between US and UK trade officials late last year showed that the acquisition of as much UK medical data as possible is a top priority for the US drugs industry. Now the DHSC and the agencies responsible for handling and selling data are increasingly under pressure to tighten up controls, to protect patient privacy and prevent information being misused. Asked if it was right to say that the patient data was anonymous, as claimed, Professor Relka Boyton, director of the Cyber Technology Institute at De Montfort University in Leicester, said, "The answer is no, it is not anonymous. If it is rich medical data about individuals, then the richer that data is, the easier it is for people who are experts to reconstruct it and re-identify individuals." Boyton believes more thought should be given to controlling and limiting the sale of data. To prevent. For more on this story, visit the news article link.